One area we didn't get into was the perinatal initiative. We did talk about sort of infant mortality on the big show. So, Joel, why don't you start with that? What is the sort of the perinatal initiative?
It's Perinatal Quality Initiative.
Okay.
It's a regional initiative, and it's actually statewide. It's sponsored by the Michigan Department of Health and Human Services, and they actually came to Chris and I last year and wanted to do a reboot here for our region. Region 3, is that what we are? 5? 3? I'm sorry. It's the Saginaw Bay region. So what we did, as we had talked about before, we have a lot of similar issues taking place regionally, but maybe different aspects going from county to county. And we had talked about infant mortality, which is a big focus, but other focuses for us are, during COVID, we had a lot of expectant moms not be able to obtain the optimal amount of prenatal care. And now we're seeing those numbers go back up, but we're also seeing that in some cases there's still a pretty sizable component of new moms that are kind of delaying their care to maybe the second trimester. So we've got to go back to basics on things. And it seems like we fought this fight for 30 years, and we finally got 90% of moms in at the first trimester, and then we went down to 70%, and then it improved, but not as much as we thought it would. But in addition to that, like the Safe Sleep initiatives and some, a lot of important work that needs to be done with health equity and making sure that new parents and new families get resources to raise their kids as best as they can. There are a million different things that we need to do and a million different things that we're doing, but the focus really is getting back to basics. And I don't know, Chris can speak more to that too.
Yeah, thanks, Joel. I think what we're trying to look at is, as he mentioned, those commonalities that exist across our counties, right? So there's like 14 counties in our region, and we're seeing across the board late entry into prenatal care, whether you're urban or rural. We're seeing like low initiation and continuation of breastfeeding rates. We're seeing poor birth outcomes. And so we're started to sort of peel back the onion and try to really work upstream to, as you mentioned, getting back to the basics, getting moms into early prenatal care. So we know, evidence-based shows that moms who experience, first trimester prenatal care have better birth outcomes. Outcomes for moms and babies are just better. Breastfeeding rates are the same things. And so marijuana use during pregnancy, now that we're seeing the legalization of marijuana, education needs to be provided to moms that it's not okay to use marijuana during pregnancy or while breastfeeding. And so those are the kinds of things that we're working on. What resources can we get, whether it's in the birthing hospital, sending moms home with like pack and plays or other resources, home visiting resources, what else can we provide to the families? And then having the resources from MDHHS to be able to help support those initiatives.
It's great to see you're working together, and I know you're moving the dial, so that's really good. The other issue that I want to talk about, for you guys to talk about here on the after show, is sort of the lead poisoning issue. So Governor Whitmer just last month signed legislation requires all 1- and 2-year-olds to be tested for lead exposure. Something advocates have said is the biggest moment in 50 years to end lead poisoning. That's saying a lot. So as health officers, I know you've been dealing with lead poisoning. You probably have already done some testing in the past. So what do you make of sort of this new legislation and how you deal with that? So Christina, you want to take that first?
Yeah, well, it's a great initiative. Just as you mentioned, we've been doing lead testing for our children for many, many years within our WIC program and at the health department to try to screen as many kids as we can. Obviously, that 1 to 2 year mark is really the recommended time in which children should be screened. And actually, in my public health career, started out in the WIC program, so did a lot of lead counseling and education with moms. And so it's usually a quick finger poke as that initial screen. And so lead testing levels now of what we're looking for in that screen, levels have come down significantly in the past decade or so. And now anything over 3.5 as a number rating on that test result indicates significant exposure to lead. And so for in Saginaw and as Bay as well and other areas of our region, we have really old housing stock where we know lead-based paints. And if you live in a rental home, of which we see many of our families, you have an increased risk of lead poisoning if it's old and the paint is chipping. Obviously, there's from soils and such, and environmental exposure to lead. And then, of course, people tend to think that is lead in my water, right? Is something that the Flint water crisis told us. And so water quality as well in terms of protecting our kids. And so I think it's a great initiative for us to be able to test, because it's not just about vulnerability, but every kid should be screened, because the lead is something that if you're exposed to it, you don't necessarily know. And so even parents that we saw and counseled said, I have no idea how this even happened. How is my children's lead? He's not over there chewing on the wall. Well, no, that's not just what has to happen or what needs or how the exposure happens. There's many different sources. And so identifying those really early on leads to, as we know, chronic lead exposure. You can get brain delays in development, and it can lead to catastrophic childhood development.
Right.
For kids.
Bill, I think this legislation takes effect, I think, January 1. So is this a game changer for you as a health officer?
It absolutely is. Before the mandate was anybody that was on Medicaid or in the WIC program or lived in a house that was built prior to 1978. So if you weren't on public insurance, if you had Blue Cross Blue Shield and you lived in the suburbs, you generally weren't tested. And as Chris indicated too, that the action levels were much higher 10 years ago. So I actually was a lead inspector at one point in my life, went and inspected homes for lead, but we never actually went into a home until it was 17 micrograms per deciliter or higher. And then now it's 3 micrograms or 3.5 micrograms per deciliter or higher, followed up with a venous test. But the big game changer is it's universal now. It doesn't matter who you are, what your income is, what type of insurance, or your housing stock. It really is truly universal, because lead you can be exposed to lead in a variety of different ways, whether it's an old home or an old school or any place that has potential for lead poisoning. But it's important to know, as Chris had said, that the housing stock in this area, particularly in the urban areas, is particularly old. In Bay City, 95% of the homes were built prior to 1945. So there is a high potential for lead exposure in those homes. And
yeah, it's interesting with the headlines we see over the last few years with Flint and Benton Harbor. We talk about the lead in the water. That's really seems to get the headline, but we're sometimes almost forgetting about the lead-based paint in these older homes that are really an issue. I mean,
yeah, and it's not chipping paint. It's really, or lead flakes or anything like that, or paint flakes. It's really the dust and the particles from doors and windows primarily, because those usually were what they treated with lead paint, because that was much more expensive to use than regular latex-based paint, and it generally wore better than latex-based paint.
So long overdue. The universal testing takes effect in 2024. So hey, we hit a lot of issues tonight. You guys are doing a great job. Thanks for sticking around for the big show and the after show, and keep up the good work. Appreciate it.
Thank you.
And thank you, our viewers, for joining us here in the after show.